Curious if you have high or low testosterone without getting blood work? Learn how to recognize key symptoms of low T and what to do to be healthy and powerful. Get the insights you need to understand your testosterone levels. What causes low testosterone? There are many causes of low testosterone. The most common cause is normal aging. Testosterone levels drop a little bit each year as you get older. Less common causes can be broadly separated into two types: primary and secondary. Primary low testosterone. This refers to a problem in the testicles themselves. Since testicles make testosterone, any conditions that affect how they work can affect how much testosterone you make. Causes of primary low testosterone include infections like mumps, Klinefelter syndrome, undescended testicles, testicular torsion, chemotherapy treatment, radiation treatment, autoimmune diseases, HIV, liver cirrhosis, and liver failure. Physical injury to the testicles, like from a car accident or a sports injury. Secondary low testosterone. This is when your testicles work normally, but other health problems stop you from making testosterone. Aging is an example of secondary low testosterone. Some other examples of secondary low testosterone are brain tumors or other problems in the pituitary gland, a gland in the brain that regulates many hormones. Hormone blocking treatment used for prostate cancer, among other conditions. HIV, obesity, diabetes, long-term use of opioid pain medications. Symptoms of low testosterone. Many men don't notice symptoms from age-related low testosterone because it happens gradually, but some people do have symptoms, especially if a medical condition or treatment brings on low T suddenly, or if they've never had normal levels of testosterone. Here are some common symptoms of low T in men. Number 1, hair loss. Hair loss, whether on the face or the body, is a visible sign of low T. Testosterone helps maintain facial and body hair, so if any of that hair suddenly thins or seems to disappear, it could be a clue that your testosterone levels may be imbalanced. Number 2, low sex drive. Testosterone creates a healthy sex drive in both men and women. If you notice your libido starting to slip and there's no obvious explanation, like stress, traumatic events, or lack of sleep, make an appointment with your healthcare provider. They can help narrow down the cause and find out whether low T might be behind your symptoms. Number 3, erectile dysfunction. Erectile dysfunction, ED, is a classic symptom of low testosterone and is often accompanied by low sex drive. If your sex drive is low, having and maintaining an erection can become difficult. While most ED cases are due to other health problems, it's likely that low testosterone can affect your sexual performance. Number 4, infertility. Low testosterone can cause infertility as well. That's because testosterone is one of the main hormones needed to create sperm. Low testosterone levels mean low sperm levels, and some men with low T produce no sperm at all. This is something you would need a healthcare provider to confirm. But if you and your partner are having trouble conceiving, you may want to have your testosterone levels checked. Number 5, osteoporosis. When your testosterone levels are adequate, some of the testosterone is transformed into estrogen to protect your bones. But when you have low testosterone levels, your body doesn't do this. This leads to your bones becoming weak and more likely to break. Low bone mineral density and osteoporosis from low T are most concerning in men over 65, but any man should be aware of this risk. Number 6, low muscle mass testosterone is the most important hormone for muscle growth. When you have low testosterone levels, your existing muscle mass will start to shrink. Your healthcare provider will typically look for this if they are concerned you may have low T. Number 7, mood swings and irritability. Feeling depressed or more emotional can be an issue for men with low testosterone levels. A healthy level of testosterone helps keep your mood in check. Because mood swings can be caused by many other health issues, it may be difficult to know whether low T is causing it. It's best to talk to your healthcare provider if you have any sudden mood changes that you cannot explain. Number 8, fatigue and difficulty concentrating healthy levels of testosterone help you feel energized. One of the biggest complaints among men with low testosterone levels, however, is that they feel tired and unfocused a lot of the time, no matter how much they sleep. If you have fatigue that lasts for weeks and can't be explained by stress or extreme activity, talk with your healthcare provider. Number 9, hot flashes. Hot flashes are commonly associated with menopause, but men can have them too. Hot flashes usually only happen in men who have gone through chemotherapy and have almost no testosterone left in their bodies. While experts don't know why this happens, if you are having hot flashes, it is important that you share this with your healthcare provider. They can help you pinpoint whether low T may be causing it. Other signs of low testosterone. There are a few other signs of low testosterone outside of the main symptoms we've discussed. The type of low T symptoms you experience may depend on when the low T develops. For example, if you have low T before puberty, your testes and penis may not fully develop. Low T before puberty may lead to not having as deep a voice too. Some men with low T may also start growing breast tissue, known as gynecomastia. It's important to share any such symptom with your healthcare provider. How to tell if you have low testosterone. A saliva test can be a great way if you experience difficulties with needles or blood samples. However, several studies have confirmed that saliva offers only a relatively accurate measurement of testosterone level. Supplemental tests, such as serum testing, are necessary to ensure that salivary test results are accurate. Your healthcare provider will also do a physical exam to check your hair growth, muscle growth, and the size and appearance of your testicles. They may perform these blood tests and exams at your regular checkups if you have a health condition, like diabetes or HIV, that is more likely to cause low T. Low testosterone treatment. Treating low testosterone is pretty straightforward. You replace what's missing. However, not all men with low testosterone need treatment. If your testosterone is gradually declining with age and symptoms aren't a problem for you, then treatment isn't necessary. For younger men with low testosterone or older men with abnormally low testosterone, testosterone replacement therapy is available in many different forms. While you're receiving treatment with any one of them, you will need to have regular blood work done to monitor your testosterone level and make sure they're balanced. Keep in mind that testosterone treatment options are also Schedule 3 controlled substances. In other words, they are medications that come with a low to moderate risk of dependence. Testosterone replacement therapy may also raise the risk of prostate cancer, heart attacks, and strokes in older men. Here are 6 different options for treating low T. Gel, applied once daily to a specified area of your skin, which will differ depending on the product you are prescribed. Patch, applied once a day on a clean, dry area of skin, preferably not a bony area, or on the back of your thighs, that can be worn while swimming or showering. Injection, given every 2 to 4 weeks by a healthcare provider or administered at home once you or a loved one is trained to do so. Nasal gel, applied 3 times a day inside your nostrils. Make sure not to blow your nose for an hour after using it. Implant, placed right below the skin of your upper arm by a healthcare provider and lasts for 3 to 6 months. Depending on where you live, you might be able to get a testosterone testing kit. You can use it to monitor your testosterone levels while you're undergoing therapy. How can I raise my testosterone levels naturally? There are a few natural forms of low testosterone treatment. Exercise, for example, is an effective way to raise your testosterone levels. Research shows that men who exercise regularly have better testosterone function. Eating healthy, well-balanced meals can also help. Diets high in fat are associated with lower testosterone levels. Also, if you have low vitamin D levels, taking a vitamin D supplement can raise your testosterone. A study in men with excess weight showed that taking 83 micrograms of vitamin D for a year led to a significant increase in testosterone levels. Lastly, getting a good night's sleep may help too. A small study found that as little as 1 week of sleep deprivation can lower testosterone levels by 10% to 15%. By comparison, the rate at which testosterone lowers each year with age is 1% to 2%. What happens if low testosterone goes untreated? It's possible that the gradual decline of testosterone with age is responsible for the effects of aging that men experience. But for most men, this is not a reason to try testosterone replacement therapy. For younger men with low testosterone or older men with abnormally low testosterone levels, untreated low testosterone can lead to some medical complications. Infertility is a significant issue for many men with low T. Bone thinning and muscle weakness that come from low testosterone can be a problem for older men. Thin bones are at higher risk of breaking, and broken bones combined with muscle weakness can make recovery and looking after yourself difficult. If you think you may have low T, talk to a healthcare provider to understand your treatment options.